Dr. Sahani sir, Dr. Angita and Dr. Onak and all those participants in this session. Good morning, good afternoon and good evening. Welcome to the 1399th day of continuous and uninterrupted Zoom session of IFPH. Today we have with us a familiar face, Dr. SADAF ULDE. And let's start the program with a silent prayer for 1 minute. Thank you and welcome back. As I mentioned, Dr. SADAF is the Director, Health Satya Foundation and Binary Institution of Teaching Faculty at the Others of Mumbai with 14 years experience. And the subject is approaches of Dr. Burnett and Dr. Blackwood in different pathological cases. Interesting and important because our young talented persons are always dealing with or studying a lot of books as well as bringing them to the fraternities interest. Well, we all know that the disease of heart, one of the monument work, Dr. Alexander Blackwood, and another one is the disease bust of Burnett, Dr. Burnett. A lot of works are also there. On behalf of IFPH and Dr. Sada, you can have the platform for the next 40 minutes or two.
Good evening, everybody, and good morning to those who are not in India. And so let's begin on today's session with much of ado. Why is today's session important? So before I go with the case and the approach, am I audible properly to everyone?
Yes, of course.
Okay, great. So why this approach? I chose it as a topic of today. So those who know me, they know me very well as I practice more of sensation method. But in my journey of becoming a homeopath, I came across and I've worked with different doctors, different senior doctors, and everybody in their pathological cases had a very different approach. You know, no two doctors were same. For a similar condition, no two doctors ever came to a same remedy. Okay. And this kind of always had an inquisitiveness that why is it that although the approaches are so different and yet the results are so beautiful, you know, like you cannot question, you know, like you may disagree with me with the remedy I chose, but the result is there. You can't do anything about it, right? So that's the reason why I always talk about that maybe two different patients do not require same approach. Okay. And why one homeopath fails and why other succeeds is maybe that particular patient required an altogether different eye or a different approach in the case taking. My difficulties when I started up with my practice were very deep pathological cases where patient would improve after giving the remedy. Okay. But somewhere the pathology kept stagnating. You know, the patient will say they're so much better, their lifestyle has changed, there's so much improvement and a lot of other reasons. But somewhere the pathology didn't move much. That's when when I started going back and reading certain books. And one of the books that really impressed upon me was Burnett, okay, Blackwood Manual, and other Grimmer, obviously the chronic disease by Hahnemann. And what I understood is that when you're teaching when you are treating a very deep pathological case, especially something like tumors, something like autoimmune disorders, you need to be proactive. You cannot give one dose and sit back. Okay. You can't, there is no wait and watch time. Treating cancers, treating autoimmune disorder is like treating something acute. We just had a session on fever. And in fever, how you are super charged up, you have to be that ways with deep pathological cases. My patients who have deep pathological cases, if they say, oh, doctor, given me 3-4 months medicine and then I will come back to you after that, I don't take those cases, because I feel these deep pathological cases, they need more and more personal attention. They need more focus. They need more follow-ups, because everything changes with brim of time. If it's a psychotic disease which is like stagnated for years, which is same, has not changed, that's a different story. But if it's a disease which can have a very quick reactions, you need to be very, very proactive. Understand. And by saying that doesn't mean that, I will start giving specifics. Okay. No, it's not. That's the reason why I need to see the patient very frequently. So let me just share one small case, and then we can explore this philosophy of Burnett and Blackwood manuals through taking this particular case as a anchor to it. So this was a case which came to me around, like, we're still on the treatment with this particular female, but this case has taught me a lot during the journeys. I like to share this case. So this was a female patient, a 65-year-old female patient. She came with history of brain tumor. She consulted me in year 2022. It's a non-cancerous, non-malignant tumor, but now there was a lot of difficulty in taking this case. Number one was this patient was mostly in unconscious state. Second thing, even if she was conscious, she didn't knew to converse in Hindi or English. Her main mother tongue was Bengali. So, the communication gap was also there. So the one who was communicating the symptoms and everything between us was the son of this female. So I said, what do I do? Okay, in this case. Now, before I even start with the case, I always ask myself few things. I'll just share my whiteboard. So my approach when I have a my approach when I have to start with a case, okay, is first I give a case record form to my patients so that they fill in and I get a fair idea about who and what the patient could be. Okay. Even before the remedy, I ask and I question myself this few questions. Okay. Is what am I looking? What's happening? Okay. So my first question is, what am I looking at? Okay. How or what approach should I take? How do I begin my case taking? Okay. This becomes a very important question for me. How do I begin my case taking? Because many times students, they tell me that, okay, you need give us a format of case taking, give us a sheet where we can ask a question and keep it fixed. But for me, it becomes very difficult to say that, because every time for me, in every case, my format of case taking changes. Okay. Like in this case, number one, what do I see? I see there's a lot of language difficulties. Okay. The patient is not in this scope of waking up and talking to me about her emotion, because she was in a not very conscious state. She was not oriented. She was like, she was just there. Okay. So what do I do in this case? So for, are you all able to hear me? Because I'm seeing some disturbance in my screen. Are you able to hear me properly?
Yes, yes.
Okay, great. Yeah, because there's something happening in my computer, so I don't know if I'm properly connected. Okay.
I think you can go with stop screen sharing, and without screen you can go. I think that's better.
Okay, yeah, I'll do that.
Yes. Yes, that's good.
Okay.
Because you
So,
are capable of explaining everything so smoothly, no problem. Yes, okay.
okay. So in this case, what I started off with is I said I will start to pick up certain physical symptoms. Okay. Now, understand this patient's physical symptoms. So many times there is this idea that mind symptom is everything. Okay. Which is not the case. You'll have to, in every cases, it's very different. So in this case, I started with, and you can always come back to the mind symptoms. There's no this thing hard and fast rule that okay, you will not. But to make your patient comfortable and get into that zone is very important. So in this case, I started with the physical complaint, and the son explained that she has severe pain in her head, especially while she's passing her stool. Okay. There's difficulty in walking, and it all started with the pain in the occipital region. Okay. And her suddenly, day by day, she started losing her ability to walk. Okay. And there was pain in the neck, but there was no relief. And they did an MRI, and they found out that there's a tumor. Before this MRI was done, there was a history of falling several times. She will get vertigo, she will fall. Anything could aggravate her pain in the neck. Slightest exertion, exercise, that will aggravate. The pain will cover the full head, and there will be watering of the eyes, and there's difficulty in walking. And while she's having this pain in her head, and every time she will wake up with this scared, or she will wake up with this, and she will tell her son that, I saw so and so, and that relative or that person was actually dead. And the son said that she will continuously have such dreams. Then in past history, yeah. So stitching pain, vertigo, that was something, loss of balance was something which was constant. Past history, there was she was suffering with hypothyroid. And son said for quite some times, number one, she had a lot of history of fall. And after the fall, we have noticed that for quite some time, she was losing her memory. Okay. She was losing her memory. She will forget things while working. She couldn't recollect things which she will usually recollect. She will have a lot of dental issues. She likes eating sour, but of late, she is not able to understand the taste of the food. So she has stopped eating, and hence her weight has started to drop. She's chilly, and she will take some water, warm water, whenever they feed him, because she was not in the state of understanding anything. Okay, it was like she couldn't understand her appetite, she could not understand her thirst. So every time they will feed water or they will feed food, she will take in, and they will feed according to whatever the dietitian or the doctors have recommended. Son said that of late, we have also seen that she keeps saying that something is coming from behind suddenly. If we go out of house, she will say there's some noise. She will not sleep the whole night and she'll say somebody's running behind her, somebody's persecuting her. She often complains of like somebody must have done some black magic or something. Some person with the long dress has come and they will take him, they will attack her. There is fear of robbers. She continuously dreams that there's somebody inside the house. So if she is sleeping, she feels that somebody is standing over her, very tall, and somebody is doing something to her. Then she will say that she's walking near a riverside. So there were vague hallucinations and delusions that she was having. In a life space situation, her son says that she has gone through a lot. Like she lost her husband, she lost her sisters who were very young and they died even before their marriage. She lost her husband 15 to 20 years back, and all the responsibilities were shouldered upon him, upon this lady. And she was very scared as to how she will finish this, because there was a son and there were daughters. So there was a lot of responsibility on her, which was pending, which was happening, and things were not happening for her. It has always been a very stressful life for her. No major issues, but these small things have made her overthink. She gets very excited with slightest noise. It's very pain. And because of her condition, she was not able to, like, we couldn't extract her feelings or her emotions. Whatever information we got this information from the son. Initially, he said that financially they were not well off because the father died, but now because the son has taken over, started working, things are a little better. So these has been the worries that were there with this woman. So in this case, before I even go to the rubrics, I'll tell you what was going on in my mind. I know this case was more at a factual level and little bit of emotions. Okay. I had a good life space situation. I had a sound idea about her nature, her physical generals, her past history, her presenting complaint. So now my approach over here was not to go according to sensation method. Okay. Because the details that I have are at a very superficial level and the information are given by a third party. Okay. Not by the person himself. So in such cases, I refrain from taking sensation method as my mode of prescription. Okay. But yes, all the information given by the patient's relative, that's what even Hahnemann in his aphorisms of case taking spoke about. When patient is not oriented, you take the details and you ask the relatives or the attendant as to what are the important things that that person has seen. In our case, the son was very active and he was nicely telling us about what all other things that matter to us, and he gave a good history to us. So out of all these things, I have to pick up what is characteristics. Now, the hallucinations that she's having or delusion she's having, one could also say is because of the tumor. Okay. Because it is a symptoms of the disease that a person will have hallucination and delusions. But what makes it important, like in most of the psychiatric cases and such cases, one of my professors, Dr. Mahesh Gandhi, will always say delusion and hallucination in psychiatric cases or in cases with brain tumors or brain pathology is common. But what is the nature of that delusion is uncommon. Okay. And you pick up that and you put that in your repertorization chart. Okay. So everything that I feel is very important, I'm going to put in my repertorization chart. Okay. So for me, I took these following rubrics. Okay. One was that she was having this constant feeling that somebody's pursuing. She's under the influence of something powerful. She is about to receive an injury. And then she's seeing ghosts, she's seeing spirits, dreams and fear of robbers, dreams of dread people. And then I take the most important thing, that is the pathology, as a part of my rubric. Now you'll say, why pathology? We don't prescribe on pathology. Yes, we don't prescribe on pathology, but we want a remedy to have a certain seat of action. Okay, now when I come to my approach, I will just talk about it even more. And the very characteristic pain she had was when she will get up in the morning on rising. As soon as she's woken up, she will have the severe headaches. Okay, I take the rubrics and I get following remedies. I have lacasis, I have simcifuga, I have silicia, I have sulfur, I have belladonna, conaium, thuja, nux vomica, arnica, okay, arsenic, macab, natrimur. Okay, so opium is there. Now, I want to now select the remedy which has this feeling, which covers the pathology, number one, which also covers these kinds of hallucinations where somebody's pursuing, something is happening suddenly to me, unexpectedly to me. So when I look at the broader picture, like I says, and also should have the pathology, which is mainly the tumors and injuries, okay, in the center. So we know belladonna is good for brain inflammations. Okay, it's a nervous remedy. You have arnica, you have opium. So my focus is on sulfur, belladonna, conaium, thuja, arnica, opium, because these are all the remedy of tumors. These are all remedies which covers this nervous state. But out of this, then I further go and say, I want only the remedies which cover a pathology that is stimulated by injuries. Okay. Now that's the working, which is not in the repertorization chart. That's my working, which is going on. So now I further come to sulfur, conaium, arnica, opium. Now I go further down and I say, I want remedies which have vertigo as a part of it, the weakness as a part of it, the subconscious, unconscious or disoriented state as a part of it. And I prescribed conaium to this person. Okay. So we know conaium has an excellent action on tumors that are caused by injuries. Okay. And also a state where there is a kind of paralytic state that comes in conaium. Okay, so I started with conaium 30, 200, 1M in plusing potency. Follow-up after a few months, they were like, the follow-ups were quite frequent, but I'm just giving you the main highlights. In June 2022, this female, we started off somewhere around April end or May beginning, this treatment. In June, she started to respond. Okay. She started to respond. She started opening her eyes. She started to be aware of her surroundings. She was much, much better in her general state of health. She started demanding things. She was asking for food. She would respond to taste. You remember the first case, the son said she does not recognize the taste. But now she started saying, I want spicy, I want this, I want that. Like, she started demanding. So her appetite improved. She was more stronger. She started moving around. She was in the wakeful condition. There was no major symptoms like the vertigos have stopped. Sometimes she will get in change of position, which again is a very characteristic feature of conaium. So there will be some episodes of vertigo where she will get when she will change a particular position. So based on that, I repeated that whole cycle again of 30, 200, 1M in plusing potency. So when I'm going to the approach of when I'm explaining you the approach, I will tell you why plusing potency and what is plusing potency. Then the next follow-up, There was no hallucinations. They were all going less. The balance was better. She's moving around. Vertigo has reduced. Often will have headaches, especially if she was constipated or something. I just plainly repeated it. In May 2023, she had a severe bout of cough. She acquired an acute viral infection, and after that, the cough will not go. And because of the cough, she had severe headache, and that headache was with heightened irritability. Son said that she shouts at everyone. Even if you ask her, Manji, what you're eating, she will come and she will, she will have a blast on me. So like it became she was like angry at smallest thing, and like you couldn't disturb her, you couldn't ask her, you couldn't do anything with her. And if she had to move or something, the headache will get even worse. Her thirst increased. There was dryness of mouth and there was constipation. Okay. So when you see this, we all know that dryness, constipation, increased thirst, quite desire to be, it's a very common remedy. We gave her Bryonia 200 in plussing method. Okay. For some time, we kept her on Bryonia. And then in June 2023, her complaints got better. Headaches was gone. The irritability was reduced. Vertigo was very, very, very less frequent. Appetite had improved. Sleep was better. And the MRI revealed that the swelling in her brain has reduced. The intracranial pressure had reduced. She's now having more wakeful hours. Plus, when the tumor levels were high, she will often have this imbalance of sodium and potassium levels, which now are much, much better and in control. Now her sodium and potassium levels are well maintained. Okay. So now at this point, we know the pathology is better. The generalities are better. We don't see any indication of the remedy. Okay. So I have not repeated any remedy, and we kept her on SL. No medicine given, and we gave SOS Coniam, SOS Bryonia, SOS, whatever we thought could be indicated. But touch wood, we didn't require anything to be given. Okay. So, and now also, when we are continuing with a treatment, like I just did a follow-up like a week back, Sun said that she's okay. It's just normal, just continue the treatment, whatever you're giving. So we have just kept her now on SL, and we hope for her further what comes up in the case to see what will happen. But up till now, this female who was like completely unconscious is now walking around. She's doing her stuff. She's doing her day-to-day course. She's eating better. She's sleeping better. And obviously the pathology also is showing the signs of reversing. So what was important over here is in aphorism 6, we often as homeopaths say that, okay, mind is important. We have to look at the characteristic symptoms. Disease diagnosis is not important for us, which actually is not the case. Okay. When I read through the notes of Burnett and Grimmers, now these were the authors who actually have cured a lot of deep pathological cases. Okay. And when you go through their writing, and even when you go to the writing of Hahnemann, okay, he says physicians should see its morbid action. So whenever you are, so I'm not saying prescribe for diabetes mellitus. Okay, you don't prescribe for diabetes mellitus. You don't prescribe for PCOD. You don't prescribe for fibroid. But you have to prescribe for what is the morbid process that is going on. You need to understand that process that is happening inside the patient, and your remedy not only should cover the physical and mental sphere, but also the morbific processes that's going inside the patient. Okay. So we need to, now what Burnett said, if you read his writing and if you go through his cases, he always said that you need to have 4 points in your mind when you are prescribing. One is the seat of action. That is what's the pharmacodynamic. Which particular organ is affected. Okay, is it a brain? Is it your stomach? Is it your liver? Is it your extremities? And if it is your extremities, or if it's whatever organ that you're targeting, what is exactly happening? So, like when you read Belladonna, he says the initial stage of inflammation. Why is that? If you go and read Phatak repertory, in the initial paragraph, when he's mentioning, Phatak mentions in what condition can you give a particular remedy. Another important remedy is Helleborus. In Helleborus, we know Helleborus as a remedy for nervous complaint. So you don't give blindly for convulsions. You don't give blindly for brain tumors. But you will give Helleborus when you see dullness and slowness of the nervous system. So anything that tells you that the nervous system is slowing down, anything that tells you that the whole system is slowing down, it's dulling down, and then there is a brain affection, you will give Helleborus. Okay, so what is the seat of action? What is the kind of action? Or sometimes you'll have a brain complaint, but there is hemorrhage in there. So your remedy changes. Okay, like you have natrum salt, arnica, they're hemorrhagic, they are injuries. So head injuries, hemorrhagic, and then the pathology is developing, you will give a remedy like arnica. Okay, so what is the pathological process going on is very important. Like in case of diabetes mellitus, we see this cases, diabetes, thyroid, PCODs very often. But there are some cases of diabetes that are caused, or that along with the diabetes, they have neuropathies developing, right? They have this numbness. Then the remedies changes. Along with diabetes, sometimes they have weakness, fatigue-like symptoms developing. Uranum nitricum is one of the most important diabetic remedy when such conditions develop. Okay, or some people have weird sensation on the skin with a lot of itching. Then you give Cesium jambulanum. Okay, so sometimes there's neurasthenia where you give Califos. Okay, so every time you ask yourself, you don't prescribe just on diabetes, but what's the process going on with the diabetes? Which organ is getting affected along with the diabetes? What is the diabetes doing to this person, right? Similarly with PCOS, we see so many cases of PCOS. But is this PCOS tending to just have an impact on the ovaries with tumors? Or do you see a different range of hormones changing? Do you see prolactin levels high? Do you see cortisol level high? And your remedy changes, okay? Because you're trying to understand what is the seat of action, what is the kind of action. Another important is range. Till what stage can you use this remedy? That's why in homeopathy you have complementary remedies. You have follows well after, or follows well by, and stop spot action. Where will this remedy stop acting? Up till what point will this act? And then when you will require next change. So this was something which was very important that Burnett said in his writing. So he said, give importance to the morbid phenomena or pathological processes that's happening. Sometimes we have kids coming to us, and they have, they come up with major problems like ADHD, autism, autoimmune disorders. I see so many small kids nowadays with type 1 diabetes. Okay. Now, what is happening over here? We know that they are all bombarded with not only vaccinations, but also antibiotics when there's a lot of protein load. So obviously we have remedies like puja, we have remedies like silicia. But if you see this repeated pattern of too much of antibiotics and too much of vaccination, and that is causing a lot of protein imbalance in the body, then you have a different set of a remedy. So just this vaccination or just autism is not enough for us. Okay. Sometimes there's vaccinations. There is so much of back-to-back allergies, back-to-back medications. You have remedies like tuberculinum. Or you see that vaccination is given and the person has directly ended up in some syphilitic disorders. Then you think of Moxol. So the important here is not the disease itself, but the process in the building up of the disease. And that's where we as a homeopath should focus upon. Like very recently, I have a case, and this case is of a Hashimoto's disease with asthma, with allergies, with lot of with. Okay. So in such case, what do? You have to take this disease. It's like entangled mesh. Okay. So here you have to understand that what is happening with the patient. So Burnett says that, the future of medicine belongs to homeopathic pathologists. Okay. Now that does not just mean that you are going to cure the name of the disease. He says that you have to understand, if homeopathy has to act, it needs to work on the morbid state. It needs to have the capacity of producing a particular state. And then only you can cure that. Similarly, if you go, like I'll now change my PowerPoint and I'll divert you to the Blackwood manual. If you read Blackwood manual, okay. Hello? Okay. Am I there?
Yes, audible, no problem.
Okay. Let me just open another. So if you read Blackwood manual, okay. So in that, he has given us a different diseases, disease of liver, disease of pancreas, thyroid body, adrenal body. That's their content. But the content of this book, you all can go and read. I don't want to comment on that. But it's very interesting in what they are prescribing. Okay, so I have just picked up some gist of their cases and I'm sharing with you here. So like, for example, there's a bitter taste in mouth. There's emptiness of stomach and stool is clay colored. Now, this is not enough. What is happening in hydrastis, he says, there's a catheteral condition. So you see, again, here they're talking about what is the pathological process that's going on. Now, I'm taking a very common condition. We see this every day, fatty liver. Nowadays, if you pick up your patient's report, almost 50% of your patient will talk about fatty livers. Okay, now what is fatty liver? It's an deposition of fat in liver due to fat infiltration. It can be alcoholic, it can be non-alcoholic. Okay, so obviously you have when there's excess of fat and carbohydrates in diet, it can lead to it. So obviously there is this diet regime that you need to give your patient. But it's very interesting in how they gave the remedies. So he says, you have to understand which stage of fatty liver is it. If a patient is in early stage, there is hyperemia, then you think of phosphorus and antimcrude. Okay. But as you go further, okay, when you're going further, okay, then, so early stages remedies where you are seeing phosphorus, antimcrude, chelidonium, and arsenic. But when you see different changes, like with fatty liver, if you see development of dropsy, okay, when you see certain debility developing, you give arsenic. Okay, phytolacca, when the fatty liver starts getting associated with cirrhosis, fatty liver with conditions associated like tuberculosis or syphilitic condition, then you give remedies like iodoform. So if you see even cirrhosis of liver, okay, in the initial congestive inflammatory stage, you will give chelidonium. If it is not, then you will give another remedies. When there is complete inability to take food because of cirrhosis, you give hydrastis. Okay, now hydrastis is a very amazing liver remedy, especially even in cases of cancers. I have used this remedy very often when in cancer, any cancer, patient has lost the appetite. Patient has lost the ability to eat, digest, and is constipation associated. 5 drops of tincture before meals is always of an excellent service. Another important remedy is Nux vomica. So I had this patient who had come with liver fibroid. Okay. History of overindulgence in fast food, indulgence in alcohol, high living society from Delhi, and was like always on the go, very irritable, very ambitious, very hardworking. But he will constantly have this sour belching, and he will be very tired. He wanted to sleep, but he couldn't sleep well. And then when he did his fibroscan, it came that he had he had liver fibroids. His SGOT, SGPT level was skyrocket high. He was developing skin complaints. I started with Nux vomica initially. It calmed down his complaint. Then we gave him hydrastis because he had completely lost his appetite. After taking hydrastis, his kind of stools that he was passing improved. Then further we added, and then it was when all his symptoms subsided, we took a detailed case of his and we understood a lot of things about him, and then we prescribed him his constitutional remedy. He was scheduled for a liver transplant, and his liver transplant got cancelled, and he's doing well. Even now, like it's been more than 2 years, his SGOT, SGPT is absolutely normal. So you see, in different cases, now what is important over here is you see that they have often spoken about what is the pathological process that is going on. Okay, that's the first very important understanding of both these authors, if you take. Okay, so first thing in the approach that you need to understand, there's a lot of things in Burnett and Blackwood which we can see in our coming up lectures more. Okay, if I get time to take more lectures, I'll talk about it. Like, he never stops. So but today focus, I will say, is let's keep how they give importance to what's happening in pathology, what's happening to the patient. Very often, as a homeopath, we tend to ignore the pathology. We tend to ignore the diagnosis. We tend to fail to pick up the reports and study the reports, what's going on with the patient. But that's not the case. Even so-called this idea that Kent was a personality prescriber, or people take pride in, oh, I'm Kentian prescriber, should know that even Kent gave importance to this. There's this famous case of Kent, of rheumatoid heart disease. This patient was in severe dyspnea. He went and he saw this patient, and he saw one thing which was very peculiar, was she was throwing away the clothes. Okay, anything around the neck and around the waist she was throwing away, and he prescribed lacases. And later, this patient developed certain joint complaints. Okay, and then he said that the pathological process, the joint, the heart, the disease is moving from one organ to another organ. And he took this rubric as metastasis, and he prescribed abrotanum, okay, to the patient. Okay, and abrotanum cleared the whole rheumatoid heart disease for this patient. So even Kent never focused only on mind or only on this and only on that. You have to focus. You need to ground. First is learn the art of grounding your prescriptions to something which is very important. That's the pathology. Then you can always build on the different mind symptoms and different other symptoms or other system of understanding that you want. But first is, are we grounding our prescription to something which is very important? And that is what makes it very important for us to understand what is it going on with the process. Now, same thing, I'll give you an example of a case of Grimmer. Okay, there was this female with a carcinoma of breast. Okay, it was completely syphilitic. There was boring pain. Bones and glands were affected. There was enormous induration. Indurations were also affecting the ovary. There was cancerous wart on tongue. So basically everything was involved. There was a lot of white discharges that was going on. There was many things in the case, but Grimmer, he picked up these symptoms: induration of part, softening of another, and corrosive action. He just took this line and he prescribed Oromure Natronatum in a repeated plus potency, and that's what caused the cure. Okay, so in many cases you will have to understand, to cure a disease, okay, you need to have some relationship with the disease process. You need to have a lot of information on how the pathology developed, how is the diagnosis, and what stage of the pathology is the patient. So, for example, I think it's Asteria rubens, where in Boric it is written that it is an excellent remedy for breast cancers when there is the lymphadenoma developing and there's the first stage of ulceration. Then there is ars iode, when ulceration in cancers have become too much. Okay, so understanding which stage the pathology is, how far the pathology is. And of course, we do not forget the mental and physical generals and the characteristic symptoms. So our results will be excellent if, number one, the morbific process matches, the characteristics matches, and then if we can get the whole sensation or any other, whatever approaches you are taking in life, or group understanding, or whatever theories you are practicing comes together. So I think, yeah, that's how I will like to now open the field for question and answers, so that we are not, I hope we are not running out of time.
Yes, that is always an important thing. Definitely wonderful presentation, and it once again reiterates the fact that we must be a voracious reader, because the homeopathic literature, especially therapeutic field, is that much enriched, because we never changes our remedies or medicines. The medicines are there, the approach is there, so it is adding and adding year by year. A lot of materials are coming. Time for discussion. Those who would like to participate, please raise your hand. Yes. So they mentioned about the seat of action, this kind of action, range of action, and spot action. That's that is interesting one, because all these are the part of the totality or symptoms or the manifestation of disease. That's most important. Then there is a big difference between this medicine and remedy. So when you use the term remedy, you must be very cautious, because there is.
I think somebody has opened up a whiteboard. That's
Yes. It's often happening. Some technical issues are there. The seat of action, kind of action, I think just designed by Richard Hughes. And moreover, this Burnett, I think he was a served in the British military. So definitely they may be thinking the pathological way also. Then what is more important is the elasticity of nature, so it makes it possible. As you mentioned initially, different type of prescriptions, different type of approaches are there, but everybody is getting good results. What is the reason? You just mentioned initially. Yes, because of, as according to Dunham, is because of the elasticity of nature's law. It's possible. All these things become the part of the totality. That's the most important thing. Then the case of the Conium Act, in fact, the multi-storied specialty hospitals often not able to attain such a result after 1 year without taking any mechanical measures. The tumor is almost reduced. Am I right? Do you have any latest investigation report there? The case?
Yeah, the last was in the June 2023. Sorry, not June. Yeah, September 2023. Now they are going to repeat it again next month. And hopefully, if I have a session around that, I will definitely share the next report of this patient.
Yes, that's good.
The last report that they had shown that the intracranial pressure had reduced, the swelling around the brains have reduced, the margins of tumor have reduced. So let's hope for much better result next when he comes for the follow-up.
That's good. Then there's a couple of questions in the chat box, I think. Somebody's asked about the book, which book you mentioned.
So it is simple, works of Burnett and Blackwood manual. It's easily available on BJN Publishers and Amazon. It's also there in your softwares if you're using Synergy software, if you're using, I think Synergy software has Blackwood manual. If we have time, I can just show you.
Yes, sure.
I can show you the software.
Yes.
So you see here, you have Blackwood heart, Blackwood kidney, Blackwood liver, and Blackwood manual. These are the books. And you have so in this book, if you see, first they talk about is the physiological action of the remedy. And then they talk about the further details about the characteristic symptoms of the remedy. So there is also this book on Blackwood kidneys and nerves.
Yes, Alexander Blackwood is a Russian doctor, I think. The
Yeah.
material is also there. This is the book on heart, Dr. Alexander Blackwood.
Yeah. So
There
like
we mentioned a lot
very,
of therapeutic tools are there. Yes.
So this is one. And then if you type in, you get this book known as Complete Works by Burnett, but you also, what I really enjoy is that, Burnett has this small books. Burnett, veins, valvular disease, tumors, tonsils.
You will get similar books like Clark. Clark also wrote a lot of books.
Yeah.
Small books on therapeutics.
More which I always look for in my pathological case is.
Yes. Well, I think these are the combined in this Best of Burnett, isn't it?
Yeah, Best of Burnett, yes. That book only, yes.
Then also E.B. Nash, another person who wrote prolifically on therapeutics. Yes.
Which has a good Nash Regional Leaders is another book. It's very important. I feel in this book also, the interesting thing about this book is he also writes about the timing of the remedies, in certain remedies, like I think in Nux vomica, he has mentioned that, or sulfur, he has mentioned that it should not be given at a certain time. Okay, like Nux vomica should not be given in the evening. You give it in the morning, and sulfur should not be given in morning, something like that.
Yes. Very valuable suggestions.
So I think, these books are something which we often ignore as homeopaths, and we are busy creating theories and stories, and we enjoy the fantasies of this, but we forget the basics of what these authors have given to us. So this is another good book that everybody should consider. Burnett.
Yeah. The French author, I think.
Right. So like he gives a good estimation of what is exactly happening with the pathology and how will this remedy act. So for example, we have a lot of time we are treating gallbladder stones. Okay. And in that, when you see when you read the USG report, they will say that there is a lot of there is a stone, but there's a lot of matter inside, which is which needs clearing out. So one of the good remedies, max sulf, to clearing out the gallbladder. It's distended with bile fluids or something. So you give this remedy. Now, in acute stages, bryonia and natramute, that helps, So podophyllum is like a drainage remedies. So if we anytime get time, we speak about what are drainage remedies, what are the remedies that are required to clear the block, as they form an important aspect of treatment. Okay, we need to understand that when and how do we use it. It's not randomly that you use this remedy.
Yes, hundreds of books are there.
Yeah.
But unfortunately,
This is
our brain
Nash.
has got not much storage capacity. That's a lot problem homeopathy is facing.
Yeah. That's why we have softwares.
Yes.
They were together in one side.
Yes. The arrival of this artificial intelligence technology in the coming days, definitely homeopathy will go further up. No doubt on that.
Yep.
Okay, I think there is no much questions, and I think our Ram Parvesh sir is there after taking a cup of tea. Sir, please.
Thank you, Dr. Manojji, and congratulations, Dr. SADAF Madam. Very nice presentation, therapeutic presentation, Burnett theory and Clark theory, and Burnett theory deals the Burnett theory. Angle of treatment, according to symptomological angle, mathematical angle, and therapeutic and pathological angle. So, symptomological angle is a very easy angle according to symptom. Acute diseases deals good treatment, and mathematical angle chronic diseases treatment, and pathological angle very difficult. Burnett deals the therapeutic and pathological angle according to rubrics therapeutic. So very thanks. Very nice presentation, Dr. SADAF Madam.
Yes. Now time for wind the session. May I invite Abdul Salam sir to express a lot of thanks. Abdul Salam sir, are you there? I think he's just left. Tomorrow we all know that our 1400 day celebrations, there continuous uninterrupted sessions, 1400 days. Tomorrow is our program that will start at 8 o'clock in the IST, in the English edition, as well as we have the Malayalam session is also there after 9 o'clock. So a nice presentation. You continue your efforts to study homeopathy and serve the people and achieve high and only mission of the physician. With the remark, let me conclude today's English edition. Hope you that we'll back again tomorrow. Till then, goodbye. And Dr. Mariam John to continue the program in Malayalam. Thank you.